Did you know that the number of hysterectomies performed in India is 40 times higher than in England and even 4 times higher than in African country Ghana? In my life as a gynecological cancer surgeon with over 25 years of medical experience, I have seen how patients stumble and forgets to take right decisions for their problem. So how do you know if you really need a hysterectomy? That's a rub. It's a tricky question. I will do my best to break it down simply. Whether you ever need a hysterectomy or not, this analysis will arm you with enough know-how to help someone else in the future. The big question lurking in the background, are there too many unnecessary hysterectomies happening in India? Today's analysis is all about digging into that with a few eye-opening facts. On the flip side, if someone genuinely needs a hysterectomy but gets spooked by all the headlines and skips the surgery, it could be downright dangerous, even life-threatening. I will share 3 real-life stories from my own practice. The first 2 are happy tales where we managed to save patients from unnecessary hysterectomies, while the third tells the tale of a patient who, gripped by fear, avoided a necessary hysterectomy only to end in a pickle. Your decision needs to be just right. Still, 40 times more hysterectomy? That is not just jaw-dropper. It is some sort of a statistics that makes you put the kettle on and have a proper think. Why are there so many hysterectomies in India? Well, the fact published in international news portals and medical journals are enough to give anyone a pause. The good news is, thanks to advances in medical science, we now have a range of treatments at our fingertips that help avoid hysterectomy altogether. That's why numbers are dropping worldwide, especially in developed countries. So stick with me. These insights might just help you or someone you care about make the right decision when it matters the most. Hysterectomy rates are falling in developed countries. Remember the days when tonsil, appendix, hysterectomy surgeries were all the rage? It was almost like a rite of passage. Hysterectomy, by the way, is the complete removal of the uterus. But here is the good news. Over the past few decades, the number of hysterectomies for non-cancer reasons has been dropping worldwide. Take Finland, for example, where people flock to see the northern lights. Their education system is just as dazzling. Back in 1989, a survey showed that 1 in 5 Finnish women had a hysterectomy. Fast forward 30 years and Hakkarainen's research in 2021 study reveals that non-cancer related hysterectomies in Finland have hit a rock bottom. Finnish women are learning how to improve their quality of life with treatments that don't involve losing their uterus. The research suggests that the discovery of modern alternatives over the past 2 to 3 decades is the main reason for this decline. Mind you, there are not just magic pills. Some treatments still involve surgery, but not hysterectomy. Let's peek at a few more stats, shall we? According to an article by Santiago Domenico and Antonio Pellicer in Medscape in the USA, 5.4 out of 1,000 women have a hysterectomy. If you are in Italy, the number drops to 3.7 per 1,000. And in Norway, just 1.2 per 1,000 women needs a hysterectomy. Before 1980s, hysterectomies were as common as rainy days in London. But since then, the numbers have been falling by about 1% each year. The same article shows that developing countries have even lower rates. But there is this million rupee question. Why isn't India, a developing country, bucking the trend with such high hysterectomy rates till now? The World Population Review gives us a clear picture of hysterectomy rates across the globe. What do numbers say about India? If you have a peek at the world's population's review statistics on hysterectomy trends worldwide, you might want to sit down first. The figures are truly eye-opening. Indian women top the global charts for hysterectomies. Now, some might say, well, India just have a huge population, so naturally the numbers should be higher. Logical, right? Not quite. These figures are based on rates. That's it. How many women out of every 100,000 undergo a hysterectomy? And guess what? India still takes the crown. To put it in the perspective, for every 100,000 women in India, 1,700 have a hysterectomy. Compare that to England, where it's only 42 per 1,000. Denmark sees about 350, Japan 344, and even the United States, with all its medical drama, clocks in just at 143. And here is the twist. Ghana, often considered less developed, fares much better, with only 434 per 100,000 women. So, understanding these numbers isn't just a trivia. It's your first step towards making informed choices and achieving your health goals. Knowledge, as they say, is half the battle won, and much less painful than surgery, of course. What's really going on then? Back in 2013, BBC journalist Jill McGivering reported from Rajasthan, raising a rather eyebrow-raising suspicion. Indian women who are having hysterectomies left, right and center, often without good reason. It gets more curious. In some places, hysterectomies were being done in camps, almost like those pop-up cataract surgery drives. At that time, Rural Development Minister Jairam Ramesh told the BBC that the root of the problem was a struggling public health system. In his words, all the spending is in private clinics because the public system has collapsed. Dr. Soumyadip Bhaumik, a former student of Bankura Sammilani Medical College near Kolkata, India, furthered his study at Liverpool School of Tropical Medicine and earned his doctorate in Sydney. He has even been an associate editor for British medical journal's Global Health section. Talk about credentials. In 2013 BMJ article, Dr. Bhaumik highlighted a worrying trend. India's hysterectomy rates are alarmingly high, and the numbers are still climbing. He referenced a 2010 study where, out of 385 women who visited the doctor with gynecological issues, a whopping 258, that's 65% if you are counting, had their uterus removed. Many were under 30, and even youngest was just 18. Hardly what you would call middle-aged. But here is a twist. Dr. Bhaumik pointed out this is not just an Indian phenomenon. Canada, for example, had a hysterectomy rate of 346 per 100,000 women, far higher than England, the USA or Sweden. Even so, India's figure of 1,700 per 100,000 leaves everyone else in the dust. Surprised? You should be. If you want to understand why this happens, you will need to dig a little deeper to make the right decision. Let's get to the bottom of it together, shall we? Why is a hysterectomy needed? The ages between 35 and 50 can be quite the roller coaster for women, with periods problems popping up more often than not. Even after menopause, some women still face abnormal vaginal bleeding. Now, for those with cancer, precancer, or rapidly growing tumors, a hysterectomy can be life-saving. That's a different story altogether. But here's the thing. A large number of women experience bleeding issues without these serious conditions. Experts say the most of so-called unnecessary hysterectomies are done for period problems. Quick fix hysterectomies have become all too common, and the numbers are sky high. Lately, many women fear that bleeding issues must mean cancer. While it is true that some specific bleeding pattern can signal cancer, most do not. Yet, out of sheer fear, many opt for surgery. That's why it is crucial to know your bleeding pattern before jumping into conclusions. Some have argued that Indian women simply bleed more. I have searched high and low for proof, but all I found was that you cannot enter temples and do pujas during your period, and there is a serious shortage of clean public toilets here. All jokes aside, there is nothing about Indian women's bodies or health that's wildly different from women elsewhere in the world. If there were, Indian women living in Norway or England would almost need more hysterectomies. But that's simply not the case. The truth is, most non-cancer hysterectomies in India happen because we skip a few steps in the diagnosis. In developed countries, when there is period abnormality, doctors first check the bleeding pattern, do an ultrasound, consider age and family history, and usually start with a medication or minor procedure called hysteroscopy, where a thin camera is used to peek inside the uterus. If those initial treatments don't work, then and only there is a hysterectomy considered. But in India, many seem to skip straight to the surgery, giving those in between steps a complete miss. So, understanding the real reasons and right steps can help you make smarter choices for your health and keep unnecessary surgeries at bay. Let's get you informed and empowered. Why so many unnecessary hysterectomies? Now, I am not the Supreme Court, so I am not here to pass a judgment. But drawing from my own experience, I have come with 7 possible reasons behind this topsy-turvy situation. By understanding these pitfalls, you are arming yourself with the knowledge to make smarter, safer choices for your health. Let's keep the focus on what's truly best for you. 1. Communication. In my humble opinion, communication between Indian doctors and women patients could use a bit of boost. All too often, there simply isn't enough time to explain what a hysterectomy is, its pros and cons, and what other options might be available. 2. The guarantee mentality. Even when everything is explained, many patients want a cast iron guarantee. With period problems, the only guaranteed fix seems to be the surgery, hysterectomy. It's a bit like chopping off your head to cure a headache. 3. Lack of patience. The minor hysteroscopy procedure, a nifty little instrument for period problems, often requires a few follow-up visits. But let's be honest, many people are not keen on repeating trips to the doctor. They want a quick fix, pronto. Interestingly, even the Royal Colleges in England notes that the satisfaction rate of hysterectomy are actually higher than non-surgical treatments. With just a little patience, most women can still avoid unnecessary surgery altogether. So by understanding these reasons, you are already one step closer to making a smarter, more confident choices for your health. Let's keep those unnecessary struggles at bay together. 4. Risk aversion syndrome. Most Indian women would rather not hear about the risks of surgery. To be fair, who wants to hear bad news before the operation? For example, before a C-section, how many moms want to know that statistically 1 in 13,000 might not make it home? Not exactly comforting, is it? That's why when doctors try to explain the risks of hysterectomy, many patients simply tune out. Unwittingly, they agree to surgery, believing the risks are 0. 5. Lack of awareness. From my own practice, I see that many modern Indians are quite ready for complex discussions about risks and benefits. But let's be honest, not everyone in India had access to formal education. For many, these medical conversations can be downright daunting. Until universal education improves, unnecessary hysterectomy will continue to be a problem here. Perhaps instead of wrestling with complicated maths and grammar in school, we should squeeze in some lessons on physical and mental health. The more health savvy we become, the less likely we are to fall into these surgical traps. 6. Insurance. Most insurance companies in India happily cover the cost of hysterectomy, but here is the catch. The amount they approve often is not enough for a world-class operation. So, corners may be cut in operation theatre and patients stay completely unaware of that. Even more frustrating, many insurers won't cover the cost of those important in-between steps, like hysteroscopy-based diagnosis and treatment. So, many women skip straight to surgery, just to make sure they get the insurance money. 7. Infrastructure. The small but mighty hysteroscopy procedure often lacks proper facilities across many parts of India. So when tablets don't do the trick, treatment jumps straight into hysterectomy. Here is the kicker. The simple intermediate surgery could reduce hysterectomy rates by up to 80% in some cases. It is not a magic wand for everyone, but many women could avoid major surgery altogether if they wish. Now, 3 real-life stories for you so that you can learn from them. Mrs. Majumdar. Mrs. Majumdar hails from Chandanagar, not far from Kolkata. She came to us fed up with a bleeding problem and declared, I want freedom. Let's just have a hysterectomy. An ultrasound raised a few questions, though the report was not crystal clear. Her medical history suggested there might be a polyp lurking inside. Instead of jumping straight to hysterectomy, I suggested we try a hysteroscopy first. She returned after 2 days looking a bit flustered. Insurance won't pay unless you write that there is a polyp, she said. Otherwise, they say hysteroscopy is just an investigation, not covered. I asked, what if there is no polyp? She replied, then I won't get the money. Thanks to this insurance tug of war, her treatment was getting delayed. In the end, her daughter, who lives in London, gently convinced her to go for hysteroscopy, explaining that's the standard approach in the UK too. With a thin camera, we spotted the culprit, a small tiny polyp. We removed it in a half-an-hour procedure and her problem was solved. The report was clear and 8 years on, she is still doing well. No unnecessary hysterectomy needed. 2. Mrs. Roy's story. Mrs. Roy is from New Alipur, South Kolkata and was battling heavy bleeding and low hemoglobin. We need to rule out cancer. I can never take something lightly. I suggested a hysteroscopy. She was not keen. Let's just go straight for the hysterectomy, she insisted. After a long chat and plenty of information, I explained that if the hysteroscopy showed no cancer, we could try an LNG IUS, a little device placed in the uterus that releases medicine. She was hesitant, worrying about possible side effect, occasional light spotting, which doesn't happen to everyone though. Her main concern, if she had any bleeding, she won't be able to enter puja room or temple. So she was much more enthusiastic about hysterectomy. Still, after some reading and reflection, she decided to give the procedure a go. As expected, the insurance company did not opt for her. Now, she occasionally had a bit of light spotting, but it's hardly a proper period. She comes for regular checkups every 6 months to a year, and the puja rituals are going strong. And most importantly, she avoided another unnecessary surgery. 3. Professor Sarkar. A renowned mathematics professor at a top university, Professor Sarkar had heard all about unnecessary hysterectomies in India. Read the BBC report. Several people around her had back pain after their surgeries. Though, fun fact, hysterectomy does not actually cause back pain. You will find a detailed article about this below. Life after hysterectomy, please look into that. Determined not to go under the knife, Professor Sarkar insisted on tablets only. But her bleeding pattern made me quite suspicious. Was something more serious going on inside? No matter how much I explained, she refused surgery. I told her I could not just mask her symptoms with incomplete treatment. And after that, she stopped coming to see me. 7 years passed. Recently, she emailed me. After seeing several other doctors and sticking to oral medications, she developed uterine cancer 3 years ago. Out of embarrassment, she did not come back to me. She had treatment, but now the cancer has returned and she is undergoing chemotherapy. You see, a necessary hysterectomy could have saved her from this ordeal. But with so much information and misinformation out there, it is easy to get scared and make a wrong decision. That's all today. See you soon with another article.